Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor and Wellness Clinic. Today I'm talking about brain-based neurology and posture combined with developmental kinesiology to address knee pain. So stay tuned. Thanks for watching. We talk about brain-based neurology and posture and developmental kinesiology, the combination of two paradigms that I use in my practice to address all issues. In this case, we'll talk about knee pain. What I've noticed in most patients with knee issues, as an example, there is the vestibular portion of the brain, the part of the hearing nerve that actually gives information to the brain about balancing. You've heard of inner ear issues causing imbalance. So we're not talking about hearing here, we're talking about the balancing component of your cranial nerve that gives information to your brain so it can determine how to balance you. A lot of times with postural failure, there is a vestibular component that needs to be addressed. What do we use for that? Very simple, a ball, a simple ball. So if I drop the ball and catch it and drop and do that, and I do it on both sides, and then I catch two balls as they're thrown at me, now I'm practicing the vestibular portion of my brain. It's all about activation of your brain. Just like if my biceps was weak, I would be strengthening my biceps. If any portion of my brain needs to be exercised, I can exercise it. To exercise the vestibular portion of your brain, you're going to simply do that, just like that. So now when it comes to the knee joint, it's very important to be able to balance the knees so it's not going in or out as you're squatting down. So you're not going too far out or too far back to catch the ball. So what do you do to practice it? It's very simple. You use a ball, an exercise ball, just like that, and you hold it against the wall and you press your knee into it and make sure that your knee joint is not too far ahead of your toes. So if need be, you bring your foot forward so you can squat down as you catch the ball. In this exercise, I'm making sure that my knee's not going in and out. This is working on developmental kinesiology, which actually there is a prelude to this very exercise, but that's how you basically train the brain to hold the joint in the right place as you challenge it through different physical activities. We were not born, and a baby is not born pumping weight or pulling a band to strengthen their muscles. They go through a systematic progression of movement which allows the brain to connect to the body parts, establish a track, a neural track, and then holding a pose using the proper muscles is how a baby gets to strengthen the muscle, to stretch what it needs to be stretched, and to strengthen what needs to be strengthened. Those are the two concepts that we use in the practice to address all musculoskeletal problems. I suggest that you visit my website. I'll make sure that we put the link for you to watch and explore the different options that are out there. Do not give up on your body and your health because it's all in your hands. Thanks for watching.